Welcome to Season 2 of Under the Sisterhood. Over the 31 days of March, we are celebrating 31 Women's March of Voices during Women's History Month. We will have intimate conversations that will uncover each woman's superpower and find out how they use these superpowers to help other women. That's 31 days honoring 31 women and their superpowers. This is a podcast to celebrate women and all that they do in our world. I'm Elizabeth Elfenbein. Let's get under the hood. Today, we're celebrating Dr. Christine Bastl. Dr. Bastl is a mother, grandmother, sister, friend, women's advocate, mentor, professor emeritus, and practicing physician specializing in kidney disease at Temple University Hospital. She was the first woman named section chief at Temple, where she was chief of nephrology. She is a board-certified nephrologist and as well in internal medicine. Dr. Bastl has been practicing medicine and healing patients for over 50 years. She has spent several decades leading research in many areas related to kidney disease and has won numerous grants and awards for her work. Some of her honors include Established Investigator of the American Heart Association and National Institute of Health Research Committee member. In her 79 years on this planet, Dr. Bastl has led a life of service and love for her family and for humanity. I am so honored to be celebrating my stepmother, Dr. Christine Bastl, during Women's History Month. She's been in my life for over 50 years, and all I can say is she's been making history for the past 50 years and more. Welcome.
Well, thank you for inviting me.
Oh, I'm so happy to be here today. Chris, I have been having such interesting conversations with women around the world, and to hear their perspectives and their stories has been amazing, particularly this month because it's Women's History Month, and it's really about a celebration of all of us everyday women who are doing remarkable things. So why don't we get going?
Well, I guess you could say I'm a historic figure since I am a kind of a dinosaur compared to your other women.
Oh, you're not a dinosaur. Are you kidding me? You're like standing on, we're standing on we talk a lot about standing on very broad shoulders. You have been setting and role modeling a life of service and care and love for so many years. And I'm really excited to share your story with women around the world. So if you will, why don't you begin and share your story?
Okay, well, it's a little bit unusual because I'm actually a post World War II baby, and at that time, my father's idea was, and most men's idea was, that it showed that if the woman had to work outside the home, it showed that he was not a good provider. So women were supposed to stay at home and work at home and not have careers. But I was always kind of ambitious and an overachiever. So that he decided that I obviously wasn't going to stay at home. So his idea of a career for me was that I should be a home economics teacher. Okay, good thing that failed.
Actually, I want to say one thing, guys. Dr. Bastl can cook and she can sew. She can do all the home. She could have been a great home economics teacher. She might not have been satisfied, but keep going. Sorry.
So fortunately, when I was able to leave to go to college, I got the idea that you didn't really have to stay home and be only a homemaker, which was where I decided that medicine was going to be my life. And I applied to and got into a very good medical school, but at that time, there were all of 6 of us in a class of over 100 medical students. So there were only 6 women. And like my father, there were lots of medical students who actually resented women being there and would come up and say, you're taking the place of a man. So that was how my career in medicine began, with essentially no women mentors.
Mm.
And so that was medical school, but the six of us did stick together pretty well.
And
So
actually,
we
you're
were
still friends, right? You're still friends with some of
right.
your classmates.
So we were a little band of six amongst hundreds of others. And we did survive. And then I did my residency where I was the only woman, which was actually, I did not no longer have my band of six people, and it was actually much harder, because of there was again the male resentment of my being there, and they actually did act out on it. So,
Can I ask a question
but
about that, Chris? I'm just kind of curious. Um, in that part of your journey, like, how did you? I know that you survived, and you say you survived, but like, how did you feel in that moment? Like and the viewers, of course, can't see you, but Dr. Bastl is a beautiful woman. Even at 79, she's beautiful. She was a stunning woman at a young age. So imagine being beautiful and friggin' smart, and being at med school and one of the only women in your class, and then going on to the residency. What was that experience like in terms of how you felt? Because here you are, like, having to get that science and take in all that information and be really good at discerning and diagnosing disease at the same time you're dealing with something that is hard to escape. How did that feel for you, and how did you overcome it versus survive it? Because you overcame it because you survived it.
well, you just had to, you had to find a way of not putting up with it, essentially. And that was hard for me because I'm not exactly an extrovert. I'm kind of an introvert. Um, so, but some of the guys actually did stand up for me, which helped, to have some protectors amongst this group. So I did make it through and got into a fellowship, where I did actually find some very strong mentors who actually believed very much in me. And I think that's when my career took off. When I found mentors, although none of them were women, but I finally found my mentors. And actually, I think that's when I decided that I was going to be an academician and actually try to succeed in a in that tough world. And I think I did succeed.
Oh, you
So,
totally succeeded. So I want to unpack that a little. So you found, and it's interesting, Chris, because I had my mentors in my life were male, and I only had literally I had one or two, and I think about it. But they were at important junctures. But like, when you think about that mentorship and taking off and going off into the world, as a woman physician, so you're in your fellowship, and beginning your life. Talk about like how that mentorship transformed you. And obviously you took off and you have a family, and talk a little bit about how you embarked on that next phase.
well, as I said, they believed in me. Um, they thought that I had talent and that I had the intelligence, um, to be what they called a triple threat. So they wanted me to be at the head of my field. They wanted me to be a teacher, a researcher, and a physician, which is why it's called a triple threat. And they actually told me what I had to do. It gave me the instructions and supported my applications for various high positions. And so um, that was uh, that was what I meant by their being my mentor. They actually kind of said, "Come on, you can do this." Took me by the hand and pushed me up. So so it was became very rewarding. and I did that for a long time. So
So this next phase, you go out after your fellowship. I know personally because you're part of my life. You moved to Philadelphia. Well, you meet my father while you're on your fellowship. But I want to talk about that because you're married to a doctor who was very supportive. Can you talk about what that meant, and then bringing, just a working mom. You're treating patients, you're doing your research, you're applying for grants. So you have to apply for grants, do the research, and you're teaching, the triple threat. Talk about that experience as well as, what it meant being a working mom.
I always say that there's nothing in my life I didn't love. Unfortunately, there was just too much of it.
Mm,
So,
mm.
um, so that that being a working mom, trying to do that, trying to be an NIH researcher, um, and was probably a little bit of an overextension, one might say. Um, but you had the idea that you could do it if you just worked hard enough, um, until you can't do it anymore.
Yeah, well,
So,
that wasn't happening. That's not the way you're built. I mean, just to give the audience, the listeners, a little bit of understanding of Dr. Bastl. She is an introvert, but she is an incredible role model. Although in some ways, and I would say that I did the same thing. It's like we did too many things where we didn't ask for enough help. Because you're such a hardworking woman in every aspect, a great mother. You would come home, cook amazing meals for your family, and then continue on to do your grant writing and everything to keep your lab going. Then you'd be doing your conferences. You'd be going around the country and around the world speaking. So talk a little bit about that journey and sort of managing all of that and the feeling of that.
um, you it is a unique life. One time I had a meeting in Seattle. I remember feeding my daughter on the way to the airport, sitting in the back seat of the car on the way to the airport, feeding her breakfast, flying out to Seattle, going to the meeting, and then catching the red eye back the same day. So I'm probably one of the few people who has flown to Seattle and back in the same day. Um, so that's the type of thing that you would be doing, to try to keep everything going.
Well, it's so interesting, and we have a lot of discussions about this because women are so we keep everything going. We always are juggling so many things. We're so multifaceted and have tremendous capacity. I mean, I think, just growing up with you in my life and seeing that and seeing the capacity you had showed me that I can and will and do. But at the same time, I think that what I've learned, and I'm only learning this now in my late 50s, is like, because we don't ask for help, we just keep going. And the tank might run a little empty. So have you felt like there were moments, I mean, like you never stopped going? Have there been ever any feelings like, wow, it's overwhelm, or is it more just you're inspired to keep it going? And how has that sort of felt like? Because over 50 years of serving has been a lot.
Well, actually, I did decide that it was too much when I was chief of the section, that it was too much for me at that point. Finally decided that that was ridiculous. And I actually stepped down from being chief, kind of retired from being chief. Probably a good thing because my smallest talent is administration. I am not I am not a great administrator, and or am I a good disciplinarian? So I was actually glad to get rid of that leadership role. Um, it was time. I had done it for 10 years, and that was enough.
Can you just remind me, what year did you, did you start as chief of nephrology at Temple? Was that,
Uh, like 1989.
okay, so 1989 to 1999. And so I'm just
Mhm.
trying to correlate that with your age, because that was a lot. And you know, Chris, what I'm thinking about as I hear you just describe that, and you just said, I didn't like that leadership position, but throughout your entire life within your family, when you went off to college, when you went off to med school, when you went and did your residency and fellowship and you got the mentors, you've been a leader your entire life. So you, just because you stepped down as chief of nephrology didn't mean you just stepped down from it being a leader. You just didn't, as you said, you lost the administrative responsibilities. Because even going out and having a lab, teaching, you've been leading the next generation of nephrologists. For how many years have you been doing that kind of teaching?
Um, well, um, I've been a teaching in medical school since 1975. So,
Wow. Wait a
so
minute. So I'm trying to count. I don't know if I can count that. Oh, wow. That's wow. Over 40. Wow. That's amazing. And and now you teach, but are you teaching just residents? Like, where are you? Are you in the med school where you're dealing with med school and then residents? Because I know we talk a little bit about
uh,
this.
well, I teach medical students. Start the first time they're exposed to me, poor things, is when their second year. So I teach in the lecture hall, and I no longer am afraid of getting up in front of 200 people and teaching. um, so that no longer bothers me. So um, and then you do more one-to-one teaching when they rotate in the hospital, and that's medical students, residents, and fellows. So for people who don't know what fellows are, they're people who are have finished their residency training and are doing specialty training. So I've been teaching fellows that long, so that I've trained over 200 fellows. So,
Wow. Yeah, and
so
one of them's yeah, part of our yeah, one of them's part of our family. You know, I remember that my father had a student who would show up at our holiday dinners, and you have your fellow Jerry, who she was your fellow first, and then she was in your lab, right? And just
yeah,
an amazing relationship and bond. Interestingly, I think that's actually, talk about that. Like, how many, when you look at the few hundred fellows, how many women, and like, what was your relationship different in training women fellows versus men?
no. Um, well, I suppose it is, because I think that women and men bond in different ways. But but when I started, actually, most of the fellows were older than I was, but that's okay. I'm your teacher. And obviously, like you, I'm kind of short, and so they all towered over me and were older than I was. But why would that bother you?
That's
um,
just another thing, right?
uh, well, you know my story about why I always wear heels,
Yeah.
because you couldn't be a woman and be short and
It's
have any authority.
and it's actually, you just hit on something, Chris. I actually had an interview a couple of nights ago with Lucia Saint Amour. She's just wrote a book called For the Forces of Good, Superpowers of Negotiation. And she went through statistics on the different levels and heights of men and where they are when you look at them in relationship to in leadership and powerful positions like CEOs and stuff. And I never thought of it that way, but yeah, you've been walking around in heels for over 50
Right.
years to survive.
I,
And
I'm I'm known as the woman wearing heels at work.
And like we have to wear heels. It's like a bizarre metaphor of how to show up and sort of get our shoulders back. It's like gives us position and power. It's such a weird thing that heels would do that. And you know, so I want to actually unpack that a little, which is more, you know, you've been such an incredibly successful human being, woman, doctor, teacher, researcher. You've like succeeded at every aspect of your life. But in the process, as you said, I was a post World War baby, and so you grew up in a very different time. So at 79, talk a little bit about just your feeling of the challenges of being a woman and overcoming all these obstacles. I know you just showed up because I know you, but tell the world about this because I think it's a really important part of your story.
Well, it was, for me, it was just surviving. Women now know much more about how to survive in this world than I did at that time, because there was no instruction book and nobody told you
Yeah.
how to do this, because there was nobody you could look at who had done it. And so nobody told you how to negotiate for a salary. Turned out I was the lowest paid person in the entire staff, medical staff. And when I found out that I was was not being paid, I went to talk to the chairman of medicine and told him that I thought I wasn't being paid well. And he says, "You're a woman. Your husband is supposed to be supporting you." So,
I I forgot about that story.
so that's what he actually said to me. And what do you do at that point? You need the job. And that's what your boss is telling you. And yet there was no recourse at that time and nobody told you how to negotiate a better salary. Obviously, telling him I didn't like being the lowest paid person didn't work. So, and it was the same when I got grants. You're supposed to be doing, you put down that a certain amount of your time is to be spent doing research, and they pay you that amount of your salary. So if you say 50% of my time doing research, then you're paid 50% of your salary. Well, it turned out I had 100% of my salary being paid to do research, but they wouldn't take me off my clinical duties. And when I confronted the chairman again about that, he said, "Well, what do you expect? When you fail to get a grant, then we're going to have to pay you again." So
It's, I mean,
so,
academic, yeah. Oh, dear.
so we can't hire somebody else to do your work. You have to do both. So, so that obviously now that wouldn't happen to women. They would know how to negotiate that field. And certainly I don't think anybody in this day and age would tell one of their staff members that was what they had to do. So I think that there has been a very big change, and it always amazes me how much chutzpah women have these days.
Well, I want to just say, you commented that there was no instruction book, instruction manual for you. Well, you've created the instruction manual for us. What and in some cases of what not to do, because I would argue at this point in our lives, I think women are trying, I mean, we are surviving and we're trying to not just survive, thrive. But I have had moments in my career where I'm just surviving, where I'm just getting through, working at a job that isn't 9 to 5 with all these demands, trying to raise 3 children and then come home and be the perfect, I don't know, a housewife or whatever the things we do, which is so much above and beyond. So that's a really tricky thing, but I think it's really helpful to hear that in your day, there was no recourse for pay inequity, and still there are huge issues. That's a big subject right now on equality and women's equality in the workforce. Isn't just women tend to do twice as much, or I don't know the exact stat of work than men do. They always take on more. They're always the go-to people to take on more. They don't get paid for it. And I don't know if it's 80 cents on the dollar now still, if it's slightly different, but it certainly isn't 40 cents on the dollar, which maybe is where you were at. I'm being, of course, I don't want to say cheeky. I'm just being conceptual. And so, yes, we've made progress. There's still so much progress to make. And it's on the backs of women like you who went out and had the confidence and stayed the course and showed us. And, and have been an example that you won't let these things stop you, even though there was so much injustice in it. Honestly, as I think about it, I sit here and I have chills because it feels so wrong. It's so wrong. You did so much for that health system, and so much for your patients, and so much for the community. And the value in which we are recognized. And I think when I'm saying value is being treated properly financially, the whole way where women are looked at holistically when we go into a workplace. I don't know if there's anything else, Chris, that you want to talk about regarding that, because I think that's a really wonderful part of your story. Not wonderful that it happened, but wonderful for women to hear that, this was a huge issue. And
Well, as I said, it's so nice that it's so much better, that at least at least there's a recognition that this happens, and there is a way of negotiating it rather than being told, well, that's life, kiddo.
yeah,
You are a woman,
and not to sort of to piggyback on you here, but as I said, the Lucia Saint Amour wrote the book on For the Forces of Good, Superpower of Negotiation, and her book takes you through the steps of how to negotiate through life. So it isn't just about negotiating. Of course, it's about negotiating your compensation package, but also it could be negotiating a conversation when you go into a supermarket and making sure you get the best deal on the products. Did I get all the coupons or whatever it might be? So, so it's interesting. It's a very interesting conversation, and I so want you to know I so appreciate the fact that you've done that, you've lived through it, and of course, I see you as this icon of just a superpower of a woman. So we're going to go move on with with the questions and talk about your superpowers. What would you say your superpowers are, Dr. Bastl?
Well, I have a wonderful memory. Tremendous memory. Don't tell me anything. I'll never forget it. So that makes my doctor life much easier. But I think my real superpower is I am a tremendous teacher. I am a great practicer of the Socratic method of teaching. So the poor people, they have to be engaged when I'm around, and I never let them off the hook. So if I'm rounding with them, they are constantly having to use their brain and constantly having to think. And I actually have been recognized as being one of the best teachers. So, and I think I am.
Oh, I
So
love
that's,
hearing that. That's wonderful.
I think that's probably it. And I think that probably my fellows would agree with me. So,
Well, I think you have, I think that's almost unfair. You have many more than two superpowers, but I want to unpack the first superpower, which is your memory. So Dr. Bastel's 79 years old, and I can say that because she is. And she's amazing. And I think she
because
has a
it
better
is.
memory. She does not forget a thing. So if you want, she could actually be the memory holder for the community and the experience holder, but which is tremendous. Talk about, like, it's really interesting to have that kind of memory and how it served you. So you said that it served you as it relates to being a doctor, of course.
And a teacher, because um, you see a patient and y- you have to you have to form an idea of what's happening and what you need to do, what the diagnosis is, and it really helps if you have this memory bank that you can delve into to come up with, oh, there are four possibilities here, and this possibility, that possibility, and the next possibility. It's much easier if you can just look in the cobwebs of the back of your brain and pull it all out at one time, which is which is I think my strength as a physician is being able to do that, and also being able to remember everything about the patient without having to even look at the chart. So I can remember what their kidney numbers were for the last 3 days without having to pull out the chart, which is very helpful. So,
Especially when you're seeing as many patients as you see a day. I mean, whew,
right.
you know.
So, yeah. And you can do this. That is, I've seen 25 people today, and I know every number for the 25 people. And I know what we did yesterday, and you know, all of all of these things. And my fellows look at me, what? So because I can pull it out of my brain, and they're trying to look at their computers to try to pull out the data. So it's very helpful for being a physician to have all of this come readily into your mind, and it helps you knowing what you're supposed to do. But the other way it helps is that if you're a teacher, you never know what they're going to ask you, and you have to be able to pull it up and kind of be like a textbook right there. Oh, you want to talk about um, type 1 RTA, renal tubular acidosis? Okay, this is type 1 RTA. You want to talk about type 2? Okay. So you have to be kind of a whole textbook in order to be a good teacher, because you never know what's going to come up in that type of teaching. If you're in a lecture hall, you know what you're lecturing on, but if you're on the floors, you never know what subject is coming up. So it's neat if you can be a textbook.
Yeah.
So,
Well, the other thing I think it gives you, which is if we go up 30,000 feet, having that type of memory and being able to call to when needed gives you so much confidence in doing your job. You can do it with so much
mhm.
confidence and conviction and authority. And that's just, I guess, the nice side effect, if you will, in a positive way of having that kind of memory. And as a teacher, it's funny because, I see you with your granddaughter, baking and cooking and teaching and reading. You're a teacher in every aspect of your life. You're very good at having that conversation and making people feel comfortable with information. And so that's a beautiful thing. But I want to ask you, what else would you say? Because I think, the way I see superpowers with you, another area is that 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 you have a tremendous work ethic and you never give up. You know, the Winston Churchill quote, never, never, never give up. That's you in a nutshell. Like if we look at and think about a puzzle metaphorically, a 1,000-piece puzzle, you will go to the bitter end until all the pieces are in place. Wouldn't you agree with that?
I've been described as having ants in my pants.
Well, yeah, you don't
because
stop.
because
Yes.
I do. That's kind of a good description. Never stop. I I have a hard time just sitting down and relaxing because I have to have my list of what I'm going to do.
What do you think that's
So,
motivated by? That's interesting, your list of what you're gonna do.
oh, I don't know. So, you have don't you have goals for every day?
Yeah.
So, yeah, so everybody has goals for every day. Mine probably gets to be a little too long. But you have your goals and you set out to do them and you can't for some reason I don't stop until I've got them done. Yes.
Well,
So,
I think that keeps us all going. I mean, it doesn't matter at what age you are, but that list, that daily, what we're gonna do today, the mission we're on. And of course, when you look at it in a bigger way, you're looking at it daily, but when you look at it over a lifetime, it's just tremendous because you just you check a lot of things off the list. So with the next question is, you have these amazing superpowers, and I think you started, of course, to describe it. How do you use these superpowers to support and help women?
well, um, I will always, as opposed to what I started out saying, which was previously there weren't very many women that I was actually teaching. Now, um, I have lots of women proteges, and I think that I have been a big influence in lots of women's lives. That I have, and I actually have lots of women who have told me that, and lots of women who still keep in touch and send me lots of love. So I think there are lots of women that I have been able to help for many years now, and it is growing in number. I think that there are more and more women who are entering my field that um, that I have been able to mentor, and I do try to be a good mentor. So, and hopefully give them something that they'll remember for the rest of their lives. So,
That is so beautiful. That's so beautiful. And I know, like, while, we have a different relationship. You're a tremendous role model, in the community and with your family. As the matriarch, the last of our parents, you just really show up in such a big way. And I'm so grateful for that. I have a surprise question for you, which is, you have a platform today to give a message to women around the world of all ages, 18 to 100, of all cultures and of all backgrounds. What do you want to tell them, Chris? What's your message to women?
I think the message is, I think the message is that um, life for women is definitely changing, and it's definitely changing for the better. And that having been through probably the tough part, the inequality part, um, I I am so happy that there is much more equality than when I started out, much more support for women. And that fills my heart with happiness that people don't have to have the tough struggle that I had to go through to get here. So,
Wow. Well, there's not much to say to that.
but that's not true all over the world.
Well, I
And
know. I was thinking that, which of course in America and certainly probably a little bit in Europe maybe, but certainly in America, that your challenges and yet the opportunities, it didn't stop you. And I think that that's just, I think you are an icon. You're an amazing woman and role model for all women. And I'm so grateful for this conversation and so happy to be celebrating you during Women's History Month. Thank you so much for joining us today and for sharing your story, Dr. Bastl.
well, I enjoyed being with you, Elizabeth.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Zach Slaff, and edited by Zach Slaff. The music is by Ayla Schaefer, her song, Rose.